For the best medical and paramedical lectures, subscribe to our channel and press the bell icon to stay connected with us.
Hello everyone, myself Swati Kaushal. Today we will discuss about traction. So let's begin. So first we will discuss the definition of a traction. Traction is a process whereby a force is exerted on a part or a parts of a body as a method of a treatment. Or we can say traction is a procedure or a process used to treat fractures, dislocation, and long duration muscle spasms and to prevent or correct deformities. So, friends, this is a definition of a traction. So, now we will discuss the types of a traction. There are two types of a traction, that is, skin traction and skeletal traction. So, friends, first we will discuss skin traction. Skin traction use 5 to 7 pound weight attached to the skin to indirectly apply the necessary pulling force on the bone. Weights are attached either through adhesive and non-adhesive tape or with straps, boots or cuffs. So friend, this is all about the skin traction. Now we will discuss the second type, that is skeletal traction. Skeletal traction is performed when more pulling force is needed that can be withstood by skin traction, or when the part of a body needing traction is positioned so that skin traction is impossible. Skeletal traction uses a weight of 26 to 40 pounds. So this is all about the skeletal traction. Now we will discuss the purpose of traction. First, to relieve pain and muscle spasm. Second, to correct deformities. Third, to reduce dislocation of joints. 4. To correct and maintain correct anatomical alignment of a limb or a bone forming a fracture. And last one is to immobilize a fractured limb as a preoperative measure prior to internal fixation. So friend, this is all about the traction, its type and purpose. Thanks for watching. Keep share, like and comment, and also subscribe our YouTube channel. Thank you. Keep tuned.
Do like, leave a comment and share with your friends.